Health reform really dictates that we start thinking differently. We're not just in the medical care business, we're in the health care business. And we start working with what we call the social determinants of health, which are those issues that are driving 90% of the cost of health care.
We are here at Lakeview Heights. We provide what I would call more of our core behavioral health services in 4 communities: Morrow, Wheeler, Gilliam, and Grant. And that's inclusive of outpatient behavioral health, which includes mental health and addictions. And then we also provide developmental disabilities in Lake counties.
What we had before, it was our responsibility to get the person to the clinician. When Community Counseling Solutions come on board, they had a complete different approach, and they took the time to train myself, the deputies, the 911 call takers, and it was about caring for that patient.
Lakeview Heights has people from all over the state of Oregon. The Foster Grandparent Senior Companion Program, that's operated in all of the eastern Oregon counties as well as the 3 central Oregon counties. If the state of Oregon is our boundary, we're providing services from the Columbia down to the California border.
Since Community Counseling Solutions became our mental health provider for Gilliam County, I have done 1 mental health police officer hold, and before that time almost everyone was a police officer hold because we didn't have their clinicians available 24/7, and so they respond actually to the crisis with us. We become safety for the clinician and for the person in crisis.
Everybody has challenges somewhere in their lives, and we should be able to access help for those challenges without stigma and without a lot of hassle.
What we have done over the last 2 or 3 years is contracted a service with community counseling where they're actually in the school working with any and all students that are troubled. They work as a school counselor of anyone that is in any kind of need. They care about the students, they work with the students, making sure that they're getting that support they need.
There's been a lot of research that's demonstrated the efficacy of animal therapy. Horses in many ways are one of the best animals to pair people with who are struggling, people who have had attachment issues, who have had trauma, and it has an amazing impact upon the residents.
Community counseling has done a great job of recognizing in small rural Oregon counties how the behavioral health professionals really can be integrated in the community.
Before we had these services, there was nothing. If you needed anything outside of the traditional 4 walls, you were going to be driving. I just believe that that's part of CCS's responsibility, is to provide a host of services that shouldn't be dependent based upon where you live, what your income level is, where you work.
We've talked about things the community needs or changes or things that need to be added, and they just say, we'll do it, we'll get it done, we'll figure out a way. They're just committed, and they don't give up.
I think Oregon has a lot to be proud of in health care integration. When we have good outcomes, we have good access, we have good community relations, and we have excellent care in a timely fashion with high quality professionals, that needs to be called out because too often rural Oregon is not well understood. Certainly I viewed community counseling as something that we could be proud of, and I'm very, very pleased that they received the award.